Good afternoon, everyone, and welcome to our second Q&A session on COVID-19 vaccines and transplant, presented by the Center for Living Organ Donation and the AstraZeneca Transplant Center here at UHN. For those of you who couldn't join us last time, my name is Joanne Carney, and I'm a board member of the Toronto General and Western Hospital Foundation. More importantly for this discussion, I'm a UHN patient. After living with kidney disease for almost my entire life, I received a living kidney donor transplant 4 years ago when my husband Brendan donated his kidney through the Kidney Paired Exchange program. And I'm really excited to be chatting today again with Dr. Kumar, an infectious disease physician at the AstraZeneca Transplant Center, and someone who has been an incredible advocate for the transplant patient community as the country and the province navigates this pandemic. Also joining us today will be Dr. Chaparro, a respirologist and medical director for the lung transplant program, and Andrea Northgate, a kidney pancreas coordinator, both here at UHN. Before we jump into the conversation, I would like to thank Astellas Pharma for making these events possible. We greatly appreciate Astellas' support for the Transplant Center and their particular focus on supporting transplant recipients and living organ donors. We are also very appreciative of the ongoing support from the Toronto General and Western Hospital Foundation. And thank you to each of us for joining us here this afternoon. We have seen a number of important developments since we last connected in February. So I'll start by asking Dr. Kumar to share some thoughts on these developments and new research that has emerged in that time. I will also ask our panelists to provide a quick update from their respective areas of practice. Following that, we will then follow a very similar Q&A format that will focus on 3 key themes today. The first, the vaccine process and what to know when you're getting one. The second, vaccine safety for transplant recipient. And then we'll end with vaccines for caregivers and family members. So without further delay, let's jump over to Dr. Kumar.
Thanks, Joanne, and thanks everyone for joining us today. So I just want to start out with some good news that transplant recipients are included in the phase 2 of the vaccine rollout in Ontario. And in fact, are right at the top of the list of phase 2. So what does this mean? This means that pre-registration at UHN is now open for transplant recipients. So you can actually go to uhn.ca and register to get vaccine. Now, just to be clear, this is pre-registration, which means we take your details and we'll contact you as soon as possible, as soon as we enter phase 2. We haven't yet entered phase 2 of the vaccine rollout, but we should be entering it sometime in early April. The Ministry of Health is going to determine when we move into phase 2. So that being said, I urge everyone who is eligible to register so that when the time comes, you get your vaccine as soon as possible. Now, the second thing I want to talk about is that you might have heard on Friday that the wait time between vaccines has been shortened for transplant recipients. So it's no longer the 4 months that we have for the general population. You as a transplant recipient can get your vaccine at the recommended interval, which is 3 weeks for the Pfizer vaccine and 4 weeks for the Moderna vaccine. This is very exciting news for us, and it's really the result of all the advocacy and leadership that our program has shown. Now, this just happened on Friday at 10 p.m. So there's going to be some issues of implementation. I think have some patience until we work out those issues. We have to figure out how to change the intervals in our booking systems and so on. So you may not be able to right away get that interval changed if you've already gotten your first dose, for example. But give it a few days, and we should be able to do this in the booking system. So next, I want to talk about some of the research that's been going on in how well vaccines have been working in transplant recipients. You probably know that several hundred transplant recipients have gotten vaccinated in the United States as well as in the UK. And in the United States, Johns Hopkins University has done a study that has looked at the safety and antibody responses of these vaccines in organ transplant recipients. In fact, what they've done is publish the first dose data on the first 480 people that have been vaccinated. Half of these people have received the Pfizer vaccine and half have received Moderna. And what they showed was that only 17 out of 100 transplant recipients actually developed a positive antibody response after the first dose. Now, this sounds like a very low number, and it is somewhat low, but I want to caution you that this is very preliminary data, and this is not data after the second dose. The second dose results are going to be released by the Johns Hopkins group very soon, and they also plan to follow up all the transplant recipients that are enrolled in this study over 1 year to look at long-term antibody titers as well. The other thing that they've shown is that the first dose of vaccine has been very safe. So I think we can be rest assured that the vaccinations have been very safe for transplant recipients. Now, I want to move on to talking about the UHN study in which many of you may be participating, and I want to just thank you for participating in the UHN study. We have had many people that have enrolled in the study. One thing I can say is that transplant recipients have received all the available vaccines, and so far our data show that vaccines are very safe and very well tolerated. They don't cause rejection as far as we can see. And our next step is now to look at how well these vaccines work in terms of generating an antibody response. If you're interested in learning more, you can email us at preventcovid@uhn.ca. So with that, I'll turn it back to you, Joanne.
Thanks, Dr. Kumar. There's a lot to unpack there, which we'll do through the Q&A, but obviously there's two really, really exciting developments that since we last spoke. The transplant recipients are now in that highest priority of phase 2, and some research showed that we need to consider how quickly we get the second dose, and that sounds like that's well underway as well. So a big thank you again to you and the team and the entire UHN Transplant for being our advocates and for having that voice during this, because it's wonderful to know that the science is out there and you guys are keeping up with it and you're advocating for what needs to happen. So thank you again. Andrea, let's go over to you to provide a quick update regarding this kidney, pancreas, and living donor community, what you're seeing and what you're hearing over the past month.
Well, we're encouraging everyone to get the vaccine or register for a date for vaccination as soon as possible. A lot of the kidney pancreas program doesn't live in and around the Toronto area, and so they're able to do that easily on the Ontario vaccination website, not necessarily having to come down to UHN. So because the pancreas program is a little bit unique that way. And we're encouraging everyone to get any of the vaccines, as they're all good for transplant patients. And the smaller pharmacies seem to be a little bit more easier to register for a vaccination dose in and around larger cities in Ontario. And in the living donor world, fortunately, if you do live with a transplant recipient, you can register as a caregiver in phase 2. Although your vaccination sort of interval will be more than likely the same as the rest of the province, with like the 3 to 4 month interval for the second shot.
Great, thank you, Andrea. And Dr. Chaparro, will you share with us what's new from the lung transplant team perspective?
Thank you, Joanne. Well, in our team, I think that we continue working as a team with the patients, all the healthcare providers, and of course, with the help of our infectious disease, and mainly the PALI has been really instrumental in guiding us and help guiding our patients. So we maintained extremely good communication with them through easy call, through letters, so that they are informed which is the current status of the vaccines for them. And of course, they are very interested in hearing every single change. So I think that we are now supporting them to proceed, to register, to get their vaccines as soon as possible. And of course, we also encourage them to continue maintaining all the health recommendations in terms of using their masks, continue protecting themselves. We continue also doing the same thing with our clinics, our testing, etc., trying to maintain them safe. So we really also emphasize that the vaccine is not going to be the cure yet for this, or that they are going to be 100% protected. We also are very happy that they are now already scheduled on phase 2, and also for the healthcare providers in their homes. I think that this is really going to be amazing. So little by little, I think that we also see the light, and the patients also see that. So we are really encouraged now.
I love that encouragement. We see the light, and we're going to keep following public health measures, but we're going to pre-register. And Andrea, you made a really good point that I should have touched on. Caregivers are, we can designate a family member or our caregiver to qualify for phase 2 vaccine, which does help, keep the community healthy. So really, again, really awesome progress over the past month. So let's transition now to the Q&A. We received hundreds of questions like we did the first time. So thank you everyone for enthusiastically submitting your questions. We've tried to tackle them by theme. So we'll start with the first around, how do I get vaccinated? So I pre-registered with the UHN vaccine registration online system. UHN.ca is how I found the link, and in anticipation of opening up for phase 2. At the end of last week, it turned out that they had, from what I'm guessing, they had an oversupply of some vaccines. So I actually ended up getting an appointment for Friday morning, and I've had my first dose, which really great news. I had no side effects, felt great all weekend. So I took that as good news. It was a very safe process, very straightforward, very organized over at the Mars Towers, part of the UHN vaccine clinic. And I felt very informed as well. They asked lots of questions. They were had a great conversation with me. The questions were really interesting. And so I thought, Dr. Kumar, we could talk about those a little bit. The screenings were on a range of topics: allergies, blood thinners, had I ever fainted from a vaccine or a similar medical procedure, things like that. Why are these questions asked?
Yeah, so that's a great question, Joanne. So the reason we're asking all these questions is to make sure that we administer the vaccine as safely as possible to people. So none of these questions that we're asking are an actual what we would call contraindication to getting vaccination. So none of these will preclude you from getting vaccination, but it's just so that we can make the process as safe as possible. So for example, being on blood thinners is not an issue in terms of getting vaccine, but we'd like to know if you're on blood thinners so that when you get the injection of the vaccine in your arm, that if we need to put a little extra pressure to make sure you don't develop a hematoma or you don't have any bleeding issues there. So that would be the reason we want to know that you're on blood thinners. With regards to fainting, we want to know if you've fainted after having previous injections or vaccines, so that we can keep an eye on you very closely after the COVID vaccine. And similarly for allergies, for allergies, the main concern here is if you've had anaphylaxis to a medication or to a vaccine in the past. So anaphylaxis means a swelling of your mouth, your tongue, or your face, and shortness of breath that comes on in about 15 to 30 minutes after having a medication. So if you've had this sort of thing happen, you should let us know, and we can definitely, work around that. Normally people are watched for 15 minutes after they get their vaccine, but if you've had anaphylaxis to something else, we may want to watch you for 30 minutes instead. So all of these things are to make the process as safe as possible.
So yeah, why do they make you wait 15 minutes? Just to make sure you don't have any immediate side effects?
That's correct. Yeah. So so that you don't, so we pick up on any immediate side effects that you're having. And if anaphylaxis is going to occur, it occurs within the first 30 minutes. So that's why there's that 30-minute range.
So if someone answers yes to any of these questions, because they might be on blood thinners, it's not an automatic, you can't get this vaccine. It's more, it leads to further conversation or perhaps an adjustment in, how long they wait, but it's
That's
not,
right.
It doesn't send someone away.
Correct. Yeah.
Okay. Similarly, I mean, what I did some digging around before this session, and I sort of went on some of the pharmacy pre-registrations to see if that's more convenient for some listeners, what I would have been asked. And they did ask questions. Do you have any of these illnesses, or do you have, some were very specific and included transplant. Others I saw were more general and talked about chronic illness. And then if you clicked yes, you sort of said, have you had a discussion with your physician and your care provider, and you're kind of signing your life away. Can you speak to those type of disclaimer questions on the registration?
Yeah. So, I guess the thing is that these vaccines are, they've been trialed in thousands of people, and they're very safe. They're approved by Health Canada. Yet we want to make sure that everybody's informed, and that everybody knows what the potential benefits are and what the potential side effects are. So that's why there's this whole sort of what looks like a disclaimer that one has to read. It's really just to keep so that you're all informed about what the potential effects of the vaccine could be. It's part of the informed consent. So I wouldn't worry about all these, long forms and disclaimers. So, it's all part of the process.
Okay, that's great to know. And you certainly, as I said, you feel very informed through the process. I did at the UHN clinic. You got lots of papers from the Ministry of Health that outlined everything. So I think it's great that you do feel empowered when you go through this. I was going to touch on the topic of the 4-month wait, because when I did register and I did get my appointment kind of last minute, they booked me 120 days or 116 days later. So now that the ministry has changed the recommendation to align with the manufacturer's recommendation, anything I should be doing now and other patients out there in a similar situation?
So, I mean, I think keeping yourself informed is the best thing that one can do. I think keeping track of when you got your vaccine and when you're due for your next vaccine would be very important, because things, if you've already gotten, for example, your 4-month appointment, you want to make sure that in the next few days, you're getting that appointment adjusted to get it at the right intervals. So I think just keeping yourself informed and making sure that you know when you're due for your second shot, for example, is important.
Great. So staying on top of things, being your best advocate. Okay. Can you speak to why there is a bit of that discrepancy, just for maybe some of the general public listening to us who isn't a transplant recipient? Why the 4 months versus 28 days versus 21 days? Can you shed some light on that?
Right. So the original trials that were done for with 21 days and 28 days. And originally, when the vaccine was licensed, it was licensed for that interval. Then we have to take into account several factors. One is that we don't have as much vaccine supply as we need. We need to get vaccine into arms. And the other thing that we have learned is that for the general population, 1 dose is also protective. And I think that's really important to remember, that that 1 dose does have partial protection. In fact, we've seen in long-term care that patients in long-term care that have gotten 1 dose, we've actually been able to reduce the number of outbreaks in long-term care just with 1 dose. And I think those sorts of things are important to remember. So when you have limited vaccine supply and you know that one dose can reduce outbreaks and can reduce infections, then what you want to do is give at least one dose to as many people as possible. Now, the issue is that that's true for the general population, but then what do you do when somebody is immune compromised? And in that setting, the first dose may not work as well. So then we have to start making these exceptions that in certain groups of people, we need to reduce those intervals down to what was tried in the original clinical trials. So I think that's how we've kind of come to the conclusion that one dose for the time being is okay for the general population, who will eventually receive their second dose. But for people that are immune compromised, like transplant recipients, like cancer patients, we need to stick to those normal intervals that were trialed.
And going back to those normal intervals, that is applicable for Pfizer, for Moderna, for AstraZeneca, all of the approved vaccines that are 2 doses here in Canada.
Yes, that's correct.
Okay, well, great. Switching gears a little bit then. I think we've covered off how we get a vaccine and the timeframes. I want to talk a little bit about the new variants that are obviously very topical in the news, and it does appear that there seems to be a variant or variants taking hold in Ontario that's accelerating us a little bit into wave 3. How effective are the vaccines against these variants?
Right. So people have heard about there's at least 3 new variants that are circulating. They are circulating in Canada as well. The vaccines actually remain fairly effective against these variants. Some of the data has shown that the antibody that's produced by these vaccines is about 20% less effective against these variants, but 80% is very effective. So I think you will still get a very good amount of protection from these vaccines. I would not worry at all about how well these vaccines work against variants. They still retain activity against variants. And the main thing would be to go out and get your vaccine so that none of the virus spreads, including variants.
Okay, well, that's really reassuring as we read the headlines and sort of see numbers starting to creep up that those who are starting to get vaccinated or partially vaccinated have a little bit of support as we go through this section, and they should continue to be effective. Another hot topic we read about in the media is the concept of vaccine passports. I know when I got my first dose, I got a receipt, a physical receipt, and an email receipt sort of saying, here's your first dose, and it has the information of what I received. But broader, there's talk about, a government issued vaccine passport. So as things open up, they can perhaps allow people to move more freely and without as much strict public health measures. Do you think the ministry is going to introduce a vaccine passport? Or will we need some sort of proof to move beyond this stage in the pandemic?
So I guess the first thing I would say is that, yes, everybody is going to receive that receipt from after your first dose and after your second dose, and save that receipt in a very safe place. What will happen in terms of whether vaccinated people will be able to interact freely with others and so on? It's unclear right now what will happen in Ontario. We know that in the United States, the CDC introduced some rules, rules that those that are vaccinated could visit others that were vaccinated in very small groups and not wear a mask. I think at this point, from what we know of the antibody data that's coming out from Johns Hopkins and other places, at this point, I would say that transplant recipients should remain careful even after being vaccinated, even after you receive 2 doses, remain careful. It's not a get out of jail passport for anybody. I would definitely continue to wear masks, definitely continue to wash your hands and practice physical distancing regardless of having received 2 doses of vaccine. So I remain very careful still.
Okay, so keep those masks in stock and put that receipt somewhere really, really safe. I mean, after this, I'm going to go put it up where I kept our marriage certificate. I think that'd be a good place for it. So Dr. Chaparro, Andrea, anything you want to add in terms of the concept of getting a vaccine and accessing a vaccine before we move on to some of the safety related questions?
I don't think so.
Okay. So let's move on to theme 2, which is we continue to get a lot of questions around the safety of these vaccines for transplant patients. So let's start with Dr. Chaparro. I'll go to you. We're learning new things about COVID and about the vaccines daily. And so since our last Q&A, have any new recommendations, any new points of views for whether it's for lung specifically or any of the organ groups around the safety of these vaccines?
I think that the recommendation really continue being the same. We strongly recommend the vaccine to every single organ transplant patient. And also independently maybe of the time post-transplant, we will just really make sure that it's safe to get it, but we definitely strongly recommend that. I think as immunosuppressed patients, with more reason, you have to protect yourself. And based on what Dr. Kumar just mentioned about maybe the level of antibodies that you will produce, with more importance, you need to really look for that protection and make sure to get your second shot. So I think that it's extremely recommended for our transplant patients. I think that we continue demonstrating that the benefit of the vaccines for COVID-19 outweigh the risks. So really, it would be worse to get COVID. So I think that independently of maybe minor side effects after the vaccine or so, it is strongly recommended to proceed with your vaccines.
I think that's a really important message, because at least what you're reading publicly, it does seem that these variants are causing, quite severe illness, and even in a younger or a different population than the first couple of waves. So I think that message of get the vaccine because it's better than COVID is one we all need to really resonate with, especially as we see, the ICUs still be very full and people suffering from very severe illness. What about rejection? Are you seeing anything in the world of vaccines and rejection that we should be mindful of?
I am not aware of anything, and really, I don't see how we can link a vaccine to a rejection possibility. So I think that the immune system will be just really developing immunity against those viruses that you get in the vaccine, but I don't think has anything to do with the possibility of rejection. I would really be recommending the patients, if you have any symptoms, anything that is out of the ordinary, before you get the vaccine, or you have questions about, should I get the vaccine now that I have this test pending, or this other vaccine pending, or this other medication pending, maybe it's important that you discuss with your physician or your healthcare provider at that moment, but I don't think that has any correlation at all with that. So just make sure to voice any concerns, but definitely not any reports and not any evidence of rejection with the vaccine.
It's very good news. For transplant recipients who unfortunately have had COVID, what should they do? Should they get the vaccine?
I think that, again, applies the same recommendation that it's out there for the normal population. You should get the vaccine. I think that you will build up your antibodies anyway. We wouldn't be able to tell what did you get after the infection or the disease that you had. So definitely, again, recommendation is for everyone, including every post-organ transplant.
Okay, so even if you had COVID, you still get the vaccine. Great. Dr. Kumar, I might go back over to you on yet another controversial topic we see out there in the news. AstraZeneca has had some question marks around it, certainly in the public forum. And I don't know whether it's a communications issue or if it's a scientific issue. Do you want to shed some light into that, especially as it relates to AstraZeneca and transplant recipients?
Right. So Joanne, first of all, I just want to mention that transplant recipients that we're aware of have gotten all the vaccines that are out there. So Pfizer, Pfizer, Moderna, and AstraZeneca, all the vaccines that are available in Canada. And we have not seen any safety concerns with any of the three vaccines. With regards to AstraZeneca, I mean, AstraZeneca has been in the news quite a bit, primarily more recently for thrombosis events. So these are blood clots that have formed in some people who were vaccinated with AstraZeneca. This has not occurred in Canada. It's an issue that occurred in Europe. It might have been with a specific lot of vaccine. It's unclear, but I think we have to look at the scale at which the AstraZeneca vaccine is being used around the world. So there have been 17 to 20 million people that have received the AstraZeneca vaccine. There are very few cases of thrombosis. It's even difficult to know whether they're actually related or they may have occurred anyways. When you're giving vaccine to such a huge number of people, you're going to get these occasional medical issues. And it's very hard to relate those to the vaccine. Just having said that, we haven't seen any issues with AstraZeneca in Canada. I would reassure everybody and say that if AstraZeneca vaccine is available to you, and that's the first one that's available and that is close to your home and you can go get it, I would definitely go get it. I would not wait for Moderna to come closer to home or Pfizer to come closer to home. I would go get the first vaccine that's available to you.
Okay, so all things are equal, go with speed and convenience. So on that note, I mean, today and in the coming days, as we officially hit sort of phase 2, patients have the opportunity to go on to the UHN vaccine registration or a similar hospital registration that might be in their area. They can go to a mass vaccination clinic in the city or in again, the region that they live, or they can go to the pharmacy registration. So they can go online in a number of different places. So you can effectively go shopping for a vaccine. What advice do you have for this community, of the transplant community?
Right. So, when you go on the vaccine website, you'll see that you have a choice of if you want to go to a mass vaccine center where they're primarily giving Pfizer and Moderna versus a pharmacy where they're basically giving AstraZeneca. And again, it's different vaccines in different places, basically because of storage issues with these vaccines. Not that they're less effective or more effective. It's essentially how they're stored. So, again, I would reiterate that you should go to the place that is closest to you, that you can get the vaccine at the fastest time available to you. I would not worry at all about which vaccine has more or less side effects, which vaccine is more or less effective. They're all equally effective in preventing severe COVID, and that's what we want. We don't want you to end up in the hospital, in the ICU on a ventilator, and all the vaccines we have in Canada prevent that from happening.
I think that's a really important nuance too. They all prevent severe COVID.
Right.
So we can try to understand the data, we can try to understand the scientific approach, but what we're really trying to do is trying to prevent severe illness. So I think if they all have that, that's a really good sign. Andrea, Dr. Chaparro, do you get calls from patients who are asking this question? What vaccine do I get? Should I go shopping? What advice are you giving them? Because I'm sure you're potentially inundated with those calls.
Absolutely. I usually say get whatever is best or whatever is closest to you, whatever you can get as soon as you can. And a lot of the registration sites are fairly easy, but I mean, not everybody is like myself is so good on the computer. Sometimes the local pharmacy is the best for some patients, especially who are visually impaired. It's a little bit easier. And I don't necessarily recommend any single one vaccine over the other. The best thing to do is just get yourself safe, practice common sense. And the best thing to do is the more people get vaccinated, the better off we're all going to be, and the less variants will be spreading around.
And Dr. Chaparro, anything to add there? Because I know the lung community is even more particularly vulnerable, given that COVID is, at its root a respiratory illness.
Yeah, I totally agree. And I think that explains the volume of calls and questions that we get all the time. But I think that we also have been trying to encourage them, try to follow the guidelines that have been posted by our team and the CST and even international guidelines almost follow the same recommendation. Don't really shop around, just get what you are offered. Plus, the other thing that I think it's important is to encourage them to try to avoid going into these chats or comments, because what you circulate around there is the bad thing that was mentioned around something. And I think that when you focus on those things, then you get anxious and you don't know what to do. So we recommend them as like really don't go through what was maybe the gossip that was mentioned in somewhere, and they are scared about that. So I think that they just have to come to us, count with us to give you the best advice possible. So we don't recommend to go for whatever is available, just take it.
I absolutely agree. Go to the experts, which may help to increase your volume of calls, but it's better to go to you guys than to go to Google.
Absolutely.
Another thing that I would recommend against is some people, not our patients, of course, but some people decide to register on a whole bunch of different websites and then see what appointment they can get first. And I would say, please don't do that, because you're going to probably screw up the vaccination process of a different place that someone else could otherwise get, because vaccinations need to go in an arm, and there's a time period that it needs to go in an arm. And so you don't want to really sort of mess about with someone else's community schedule. So just pick one, go there, stay there, and it'll happen. It's a massive undertaking. This vaccination process. I'm surprised how smooth it's going, actually, with all its warts and all.
That's a really good point. Only register once. When you do go to your pre-registration at the UHN website, at least, you do click a box. I'm only doing this once, and I'm not out there signing up to every registration. So obviously that's important for the entire public health message. And Andrea, to your point that not everyone is computer literate, and that's absolutely true. I think there's phone numbers and there's other places to call, but ask those around you, ask for help, because they have made these online portals very easy. And while they may not be as easy for you to navigate, there's a millennial or a Gen Z in your life who can keep their distance and help you. And I think they'd be very happy to do that, because I actually have been impressed by the portals and how efficient they've been in the palm of my hand. So let's move on to that note. Let's move on to our third theme, which is, getting our caregiver or our family member vaccinated. So, Andrea, I'll go back to you here. Where do caregivers or family members, and are they the same thing, a caregiver and a family member, where do they fit on the list of priority?
Well, I think you can, well, it depends on how many people you live with, but I think the best thing to do is pick the one person in your life that you have the most closest contact with, and also the one who you would deem to be more at risk. So if you're living with like your, mother of 70 years old or your husband of 50 years old, I would pick them as your main caregiver, as opposed to just sort of your, maybe a son or daughter who's like much younger. Pick the people who are most at risk, which would be an older person. And I think that, they would register at the same place as you register at. But they do need to wait the larger interval. But at least because their immune system is presumably a little bit healthier not immunocompromised, as a transplant patient is, that they would still get that an immune response from the first shot. So it might be a little bit safer for them to wait the longer interval.
And so it's true. A caregiver is a family member, or unless you have a sort of designated caregiver, is one of your family members. And I think your point is very clear. The one that you have the most interaction, and therefore the most also likely to sort of be a point of spread towards you for COVID. What about everybody else that might be in your household? If you live in a family of 4, what should the other people do who are further down in the priority list, who can't get vaccinated sooner rather than later?
Well, they should be following the guidelines that everybody else has followed. Good hand washing. I'm a nurse for 30 years. I've said this about 1,000,000 times. Wash your hands. It's just the safest way. Physical distancing. Stay within your small bubble. Don't go out to eat if it's not with people you don't live with. Now is not the time, right? And follow just sort of good guidelines, and mask when you go out, and just sort of follow the regular guidelines that everybody else is following. And I think eventually this will be over. This will be something in the past. Eventually this will end. But I think we just need to sort of stay the course. I know it seems long and it is a little boring. We don't wash our grocery bags anymore, but it's important that everybody just stay the course for a little bit longer. And I have great faith that we will see the end of this. And then we can brag about it later on. We can say we all lived through the pandemic.
Oh, I think there'll be lots of stories of living through the pandemic for the years to come. I can picture all the movies and TV shows now. Contagion Part 2. Just a quick question on the caregivers, and perhaps this is getting too detailed, but when you go on the UHN registration, again, we mock this up because Brendan is both my husband, so we sort of can designate him as a family member and a living donor, but I'll come back to that. You have to check, why am I signing up? And you can choose essential caregiver. And then you have to select, are you a patient of the hospital or do you live in the region? And what happens if the answer is no to, like, he's not a patient because I'm the patient. And if you don't live in the region, what advice do you have for the caregiver? Better for them to go to the to the pharmacy route, or can they kind of select, I'm a patient because they're the caregiver of a patient? Anyone want to answer that? Am I getting too detailed?
Well, I have no idea. So I would say if you don't live in the region, it might be just easier to just go within your own region and get it that way, rather than just sort of trying to figure out sort of the algorithm. Essentially, he is a patient because he was living donor impaired exchange though. It's hard to sort of disseminate through all of this, but I would say the easier method would probably go within the region because it's just as straightforward. It's just the same algorithm when you register elsewhere.
Okay, so I think we go back to the message: go what's the most convenient and the fastest for you. So, Dr. Kumar, we'll go back over to you. Let's talk about the pediatric transplant population. Where do they fit in eligible criteria? Both, one, if they're children who've had transplants, or two, parents of children who've had transplants.
Right. So children at this point, we can give vaccine to anyone over 16. So this is where, again, the vaccine trials were done in people over age 16. Now, for those that are less than age 16 and have had transplants, right now, we don't have very good scientific data on the safety of the vaccine. However, I will say that there are trials going on, and they're going on very quickly. In fact, we expect to have data on children with these vaccines by the fall. So we just have to wait the summer, and then we should have some data for children. In the meantime, what do you do? So in the meantime, the parents of children are technically caregivers and could register as caregivers of a transplant recipient. So I would encourage you, if you do have an immunocompromised child in your household, you can actually register as a caregiver and get your vaccine for the child. And then you've kind of essentially protected them as the circle of care.
Okay, and that's great news. They're moving so quickly on the trials or the research to see, the efficacy for children, because that might help to look at a different fall ahead of us. The other population I'd like to ask about is those who are waiting for a transplant, whether they're on the wait list or they're sort of at the end stage of organ failure. Where do they fit on the priority list, and what should they be doing at this point in time?
So again, those that are waiting for transplant do have what we will call chronic organ disease. And so they do fit into the chronic disease category, and phase 2 is all about the chronic disease category. So anybody who's waiting for transplant should be able to get vaccinated in phase 2. In fact, we're already seeing some pockets of patients getting vaccinated. For example, those that go to dialysis centers are starting to get vaccinated. Dialysis centers, as you know, have had a lot of outbreaks, and patients who are on dialysis are at risk of severe COVID. So those groups are starting to get vaccinated as well.
And would their caregiver or their close loved one also count as an essential caregiver who can get a sort of a priority on the vaccine distribution list?
Yeah, so there's, we talk about those that are at risk and their caregivers. So, if you do have a high risk chronic disease, you get vaccinated plus your caregiver. That's right. So caregivers would fall into that phase 2 as well.
Okay. Any other thoughts anyone wants to add about sort of the community around the transplant patient, around how they should access getting a vaccine, when they should access, and anything they need to be mindful of? Have we covered our bases?
I think so. You did a great job.
Okay, so then before we then finally wrap up, Dr. Kumar, do you want to give us any sort of final thoughts, any takeaways you want our viewers to leave with, and knowing that we'll meet again in a month from now, and hopefully, I mean, we've had tremendous updates and tremendous movement over the past month, so I can only imagine what we'll have to talk about a month from now.
So I just want to say we'll have hopefully a lot more information a month from now in terms of maybe more antibody responses and more safety data. But if there's anybody in the audience or anybody listening who is still hesitant to get the vaccine, I would say inform yourself, ask your healthcare provider, ask your transplant coordinator, get all the information you need. I can tell you that definitely the risk-benefit ratio falls towards getting the vaccine. And, hundreds, if not thousands of transplant recipients around the world have received vaccine already. And even if we don't see the antibody response, we know that these vaccines have partial protection, and they do work. So, I would definitely go ahead and get your vaccine. Especially now we're getting into the third wave, so that becomes even more important.
Yes, that race of the third wave versus the critical mass of the population being vaccinated is quite a tight race right now. So I think being informed and making those decisions are very important. And I look forward to receiving my second vaccine when the system allows me to, whether it's in the coming couple of weeks. And again, I encourage everybody who's listening, if they haven't already, to sign up for the pre-registration. You can find the link at uhn.ca, and it's a very easy, simple process. And then once you're there, again, it's a very safe and streamlined process where you do feel empowered and informed. Thank you to the three of you for joining us again this afternoon. I do want to speak again as a patient and say it is simply remarkable how each of you and your colleagues at UHN Transplant, at the Ajmeri Transplant Center, I should call it, sorry, are truly advocates and championing the unique needs and the research for the transplant community. To knowing a pandemic is all about sort of the public health at a policy level is one thing, but then understanding that you have advocates who are putting your sort of needs first and foremost is a wonderful feeling as you work through what is a trying time for everybody. So thank you again. I know it's been a really long year for everybody who works in the hospital systems and healthcare, but know that you're very much appreciated and that the work is keeping everybody optimistic. And to go to Dr. Chaparro's, there's light at the end of the tunnel, and we can see that happening as we lead into the sunny weather. So thank you again, and thank you to all of our viewers and listeners today. Remember, we'll be hosting this again on April 22nd. You can register for our third Q&A at givelifeuhn.eventbrite.ca. And please keep submitting your questions to slido.com with the event code ATC-COVID and upvote the questions you wish to see prioritized, and we'll do our best to tackle those. You can also find additional resources about COVID-19 and vaccines on the Canadian and American Societies of Transplantation websites, and those are listed on the screen, or they'll be available at a link that follows. And as always, just a reminder that if you're going into any UHN hospital, please review the UHN COVID policies beforehand. There continues to be a no visitor policy in effect, so please respect that. And you can watch for any updates on these policies and rules at uhn.ca. And a final thank you to Astellas Pharma for making these Q&A sessions possible and the ongoing efforts and support of the Toronto General and Western Hospital Foundation. Thank you again for joining us, and we look forward to seeing you on April 26th.